More than 60 people die every day in the United States from prescription drug overdoses. That translates to almost 22,000 people annually. An alarming statistic is that 70% of the people who get these prescription drugs get it through a friend or a relative, and 84% of that is from a prescription. Approximately 6.5 million in the U.S. Abused prescription drugs in 2013, and prescription drug abuse is more than double the amount of drug abuse from heroin, cocaine, and hallucinogens combined. Prescription drug abuse is the third leading cause of death in Los Angeles County, and this disproportionately affects our youth, the ages between the ages of 12 to 17. Opioid abuse translates into higher health care costs. An estimated $72 billion in annual cost to health insurers. And what that does, that translates down to everyday consumers and employers who are providing health plans. As a dentist, I treated patients with oral and facial pain who had legitimate reasons to have prescription these kinds of prescription drugs. Unfortunately, some of those patients over time became addicted to these medications, and I saw a lot of patients over the years who actually were addicted to other pain medications from other providers. Crushing, cutting, dissolving pain medication for injection leads to the possibility you could inhale it or inject it, and these are dangerous ways to abuse this drug, and that's what we're seeing out there. This is what most often leads to drug overdose. Our legislation widens access to abuse deterrent formulations or formulas. We call them ADFs for short. In essence, it's a breakthrough technology that will protect the drugs against manipulation and abuse. And you can make it into a powder that you could easily then liquefy this, or right now you could go ahead and inhale this nasally and get an immediate high from that. You can take and crush this very easily, make it into a powder, liquefy that, inject it, or just go ahead and ingest it through your nose. I can pound on this, and there's really nothing done to that. That piece of medication is still completely intact. And we'll just take this in a coffee grinder here. See, it's kind of bouncing around, making a lot of noise. But ultimately, it's still intact. So it's still intact. You can't abuse it, but you can take this, and it'll digest in your system, and it'll give you the pain relief that you need. But you can't take and abuse it, so you can't inject it, you can't sniff it.
Prescription drug abuse is a leading cause of death in our county and rural counties. In Mendocino County specifically, we're almost double the statewide average of deaths and rehabilitation for prescription drugs. So it's certainly very important to sheriffs, and the California State Sheriff's Association was amongst one of the first organizations to fully endorse this, and it was very little discussion because we believe in this.
Early studies indicate that ADFs can reduce overdose deaths by 20 to 30%. And if those numbers are accurate, we're looking at saving between 5,000 and 7,000 lives annually and billions of dollars to consumers. So AB 623 will allow healthcare providers to prescribe a less than 30-day supply of opioids. Healthcare providers will also be able to determine when an APF opioid is appropriate, and will also require pharmacists to counsel people about opioids, how you store them, and how you then dispose of them when you don't need them. So while it won't cure the problem, it will be another tool for us, and it will be significant in our ability to hopefully reduce significant number of drug overdoses.